I remember just trying to listen to podcasts about different things in terms of like pelvic health and women's menstrual health, just to get comfortable hearing the terms.
That way you could say them.
Yes, exactly. So then you can say them, right? Right, exactly. And so it's like, let's normalize saying the word vagina as we normalize saying knee or shoulder. Like, we can normalize it.
Yeah.
But I think, again, so much of us grew up conditioned to not talk about those things, which what we've seen is if you don't talk about them, it doesn't lead to less issues. It just leads to less people getting help for these issues.
Yeah.
So yeah, anything in the pelvis region I treat. So anything related to bladder, bowels, abdomen, pregnancy, postpartum, sexual dysfunction, that is my bread and butter. That is what I treat. And so I will see people, I see even kids sometimes. So I'll see people as young as a couple years old. The oldest patient I've ever had, I think, was 96. Okay. But primarily I'm working with people now who are in this pregnancy and new postpartum stage who like to stay active. They want to run. They want to go to workout classes. They want to stay active and keep up with their kids without having all of the problems that we hear our moms and our grandmas and our aunts complaining about, like peeing your pants.
I was going to say, is it the like random peeing in your pants?
Yep, exactly. Yep, peeing your pants or like pain with sex or just like chronic low back pain. I don't know how many parents complain about having back pain from just taking care of their kids.
Yeah.
And so the people I work with are like, no, I don't want to live my life like that. I want to stay active. I want to keep up with all of the activities. I want to be the strongest version of myself, stronger than I've ever been. And
that all comes to like,
it all comes back to the pelvis.
Care.
Yeah.
What got you interested in that? Like,
oh, that's a great question. I think there were a lot of things along the way that just led me into this world of pelvic health. So for me, I grew up an athlete. I did dance, I did gymnastics, I did cheerleading, I ran track. And I experienced pelvic floor dysfunction myself. So having never had babies before, I was peeing my pants while tumbling or sprinting. And I was like, this is weird.
Can I just tell you how much I love how honest you are about all of it? Like, and you don't even like bat an eye or like, I was peeing my pants while I was tumbling.
Yes.
Because most people, right, they would be like, oh, well, there's something that happened. You're like, did you pee your pants?
Yes.
Sorry, I just had to like inject and say, I love how... Continue.
Yes. I will say it took a lot to get there, definitely, because I grew up in a culture, in a family that was like very conservative and very religious. And so like talking about that kind of stuff was not the norm. But now doing what I do, it's like, it's just part of normal conversation.
Yeah. And it should be.
Exactly. And if we normalize that conversation, then more people can understand when it is necessary to seek help and that, first of all, you don't have to pee your pants or you don't have to experience these issues, whether you've had a baby or not.
Yeah.
I think a lot of times people prior to pregnancy, they're like, oh, something's up. Like, that's weird. I've never had a baby before and I'm peeing my pants while sprinting.
Yeah.
That's an issue. And so that's how I started to dive down into that route. But I think a lot of people who have had babies have just been told, like, that's what happens, or you're just going, that's what happens. You're going to experience
Life has changed now. Now you will be.
And so that's kind of as far as they go a lot of times because they don't know that other options exist.
Are these doctors like specifically?
Yeah, sometimes like you'll ask your OB about it and they're kind of like, well, that's the price you pay for having a baby. Like I've literally had patients tell me that their OB told them that.
Yeah.
Or sometimes they'll ask their doctor about it and they'll say, okay, just like do Kegels and try that for a few months, and if it doesn't get better, then...
How about those one little machine things where you sit on it?
Yeah.
And do stuff? No, okay.
So I like to look at everything from a functional perspective. And so, I guess if you were having issues with like sitting, maybe, but chances are like getting a machine to activate your muscles for you while sitting is probably not going to translate very well into like being able to jump on the trampoline with your kids or run after your kids. The muscles aren't working in the same way with those machines. So again, we like to look at everything from a functional perspective and kind of what is going on. But yeah, there were a lot of things that just kind of led me down this path. So my own experience, and then my sister during her first pregnancy had a ton of pain and she had no idea what was going on. She kept going to the emergency room, and of course she's pregnant, so they're like, well, we can't give you anything. We don't really know what to do. And finally someone was like, I think you should see a physical therapist. Like, I think a physical therapist might be able to help you with this. And she was referred to one who specialized in pelvic health and pregnancy and postpartum. And it was like she stood up in the waiting room and they were like, oh, we can see what's wrong with your pelvis right now. And they were able to kind of address that and fix that, teach her different strategies. And she went through the rest of that pregnancy. Like, she had to move houses in that time and was good, didn't have any more pain, and had 3 more pregnancies and was able to manage that and never get back to that level of pain or discomfort again.
So does this coincide with pain that like most people will say go to the chiropractor? Is that similar? And then they'll adjust.
Yes.
Is it the same thing? Similar?
Yeah, good question. So I would say
that
definitely.
was me. I was in so much pain. Like, yes, when I was pregnant, I was also like 80-pound pregnancies for 5-pound baby. But but yeah, so much pain, and that's the chiropractor. But it didn't necessarily.
Right. And so I guess it depends, of course, like what is going on. I'm typically looking at things, and when I see people dealing with pain, usually it's a combination of maybe there's an alignment issue, but there's also a muscle activation issue, or there's a compensation happening. The way that you're moving or you're doing something is causing things to not be happy. And so, yes, we can go to the chiropractor, and I love chiropractors, and they are so helpful in our treatment, but we also need things to kind of follow up and reinforce. And like I said, we want to look at everything from a functional perspective. And so if we go to someone for, even if it's PT, 1 hour a week, and then you do nothing outside of that, we're probably not going to get pretty good. We're just not going to get good results. So yeah, from like a pregnancy perspective, the pain that I see people experiencing, whether that's like back pain or hip pain or just like pain with rolling, or maybe it's that pubic symphysis, like in the front of your pelvis feels like you got kicked in the crotch kind of pain. We deal with all of that, and we teach you different strategies and how can you manage that? How can you actually get into a more comfortable position? How can you go through pregnancy without pain? Because that's actually very possible. It's so possible. I just had a baby almost 8 months ago.
Oh my gosh, congratulations.
Thank you. And it was like, because again, first pregnancy, I was like, okay, I've been telling people this whole time, that you can go through pregnancy without pain and that you can do all of these things. So let's prove it to myself. And you really can. Like, I felt good during pregnancy, but I also put in quite a bit of work in terms of making sure I was staying active and mobile and kind of working the right muscles and making sure that I had good support for my body, and was like really viewing it from, again, this like PT doctor perspective. Versus like, okay, I'm just gonna kind of do what my body wants to do. I was very intentional about the work that I was doing. And so again, if you run into pain or discomfort, we can address that. We can make that so much better.
So what is PT for people that have never been to PT? They have no idea. We talked about chiropractic, we're just adjusting.
Yes.
Not bones, but
Yeah, so chiropractor, it's like, I mean, they call it like adjusting the nervous system.
Okay, I just say like snap, crackle, pop. They hate when I say that though.
Correct. So physical therapy is going to be the profession that looks at the way that you move and function. And so we are all about optimizing movement, decreasing pain, improving your function, improving basically how long you live your life. And so we view that from a lot of different lenses. So we're going to view it from a movement perspective in terms of exercise and stretches and mobility, and do you have restrictions in the way that your body is moving? Do you have, tight hips or a tight back or tension that you're holding in some of these areas that we then need to address, whether that's through maybe some hands-on manual therapy, or again, we teach you different stretches or exercises. But really what we do at the basis of physical therapy is we teach you how to move better. And how can we teach you how to move your body in a way that decreases pain, that improves performance, that makes you, like I said, live longer and feel better throughout your life. So
I didn't know people could teach you how to move better.
Yes.
Right?
Yes. Yeah. And so that is what I do. And from a pelvic health perspective, I teach you how to move better so you can stop peeing your pants. You don't have pelvic pain. You can have a really great pregnancy. was telling someone the other day, like, you can have really good postpartum sex too. And like, that's what I get to teach people to do all of the time.
So
it's so fun.
Yes, and I love it. Do you have an Instagram, YouTube?
I do. I do. I have an Instagram,
say,
yes.
I hope you definitely share all these like little tips and like your passion and energy, because I can feel it in this room.
Yes,
like, you've got
definitely.
so much passion.
Yes, absolutely.
And so you have your own business?
We do. Yeah,
Tell me about that.
So my husband and I run a business together. It's called Virtual Physio. And so he actually started it in 2020 as a response to the COVID-19 pandemic.
Now, what did he do before that?
He was also a physical therapist.
Okay.
And so he was working in a clinic, and the whole world shut down, and people really couldn't access physical therapy, which kind of is a big deal because, like I said, we're teaching people how to move better, how to decrease pain, how to live longer. And the longer you wait to access PT services, the longer it's going to take to address that issue. And usually, especially what we saw at the beginning of the pandemic when things shut down, people were in really bad shape by the time they got to us because they had delayed care or delayed getting help for so long because nothing was open in person. And so he decided to create a business that was all virtual at the time and offer PT services in a virtual capacity. And people laughed at us. They thought that was absolutely insane and crazy. And how could you offer physical therapy online? And it really took off. People started realizing how beneficial it was and how much we could actually teach people and empower people with the tools. And we can actually, again, I can teach you how to move better, how to use your body better, regardless of whether we are in the same room or you are in a different part of the world. So that's really the cool thing about what we do in our education. The power is not in our hands, the power is in our brains and the way that we can teach you how to, again, live your life better, move better, find ways that work specifically for you. And so he started this business primarily all virtual, trying to help people get out of pain and deal with back pain, neck pain, things like that a lot of people were experiencing at the height of the pandemic. And like I said, we saw great success. And so at the time I was training in pelvic health and really, really loving it. And I was like, I think we can do the same thing from a pelvic health perspective. In fact, I think we can do it even better.
Yeah.
Like, I think we can address these issues of leakage and healing postpartum and preparing through pregnancy for birth and postpartum. I think we can do it virtually as well. And people started getting even faster results going through the virtual aspect.
Wow.
Which I thought was like...
Why? Why do you think that is?
I think it was just because again, like if you're going to PT, traditional PT in the sense, it's usually you go, at least the way that we do it, it's like, okay, you're with your PT for an hour and maybe you see them once a week or every other week. So it's not a lot of time like one-on-one with that person versus what we were offering online gave you much more access to your PT, like to kind of pick our brains, to brainstorm things, to say, hey, this is going on. But it also gave us access to really look at how you were living your life. What were you doing from basically the moment you woke up to when you ended your day? How could we make sure that you got your exercises in? How could we make sure that you were, drinking your water or making time for stress management or, practicing these different things that we had talked about so that it really integrated and it just became part of your lifestyle so that these results stuck.
Were you like, show me your bed and how you get up in the morning?
Absolutely. Absolutely. And I had people, like for instance, I had someone, she was like, I'm having leakage when I stand on the Peloton. So, okay, great, let's get on the Peloton and let's figure out what's going on. And we talk through different strategies. And now she's got those skills and that knowledge for every Peloton ride for the rest of her life to not leak.
Yeah, because it's not like you had a Peloton necessarily in your space where you're like, or if somebody was like, yeah, I get out of my bed like this.
Right.
Okay, here, lay on the bed, let's show you how.
Yeah.
That's so cool.
Yeah, so we started offering, like I said, virtual pelvic health services and people, again, started getting better, faster, and it was cool to see. And then, like I said, I had a baby almost 8 months ago and we decided, okay, what else do we want to do? I was working in another clinic, like full-time, and then helping him as kind of like a side job for me while it was his full-time job. And we said, okay, like let's just go all in on this. It's really working. And I think if we devote all of our time and energy, people people will feed off of that, right? Like, again, you can see how passionate I am about this.
I can, and I love it.
And so that's what we did. I was like, all right, we're going to have a baby and we're just going to go all in and we're just going to do this and we're going to make it work.
Yeah.
And so we started offering more in-person services for people in Loudoun County and Fairfax County. So that way they have some of the hands-on aspects to really kind of work on whether that's like manual restrictions or they want to have their partners come in and learn some of the hands-on techniques that we do. Our job really though is to empower them with the tools, whether we're seeing them in person or we're seeing them virtually. I want to empower you with the tools, the knowledge. I want you to know what's going on with your body and I want you to understand how you are going to address it when I'm not there.
So do you guys do like memberships or how does it work? Because it's all online.
Yes.
Or
so
a lot of it, some of it's online.
Right. So yeah, I guess like that's a great way to put it. Yeah, we do have membership options available, like a monthly membership option. And then we also do specific programs. So our signature program is our postpartum performance program. So this is for individuals who are relatively newly postpartum or dealing with issues still from having a baby. They want to address those and they want to get back to that higher level of activity. So the individuals who are completing this program are typically ones who are getting back to like they're running 10 milers or, you know, they're lifting at CrossFit. They're going to Orange Theory or, you know, your higher level fitness classes. And so it's really about bridging that gap from here's postpartum rehab, here's what you were doing previously. How do we make sure, how do we get you there and then make sure you don't get hurt or run into issues in the interim? Because I think people hit 6 weeks postpartum and they're like, great, I feel good. Yes, go. It's like ready, set, go. And you run and you hit, I don't know, 6 months postpartum and people feel terrible because they're doing all of these things and their body is not ready and they haven't had the time to actually recover and rehab in a way that is intentional.
Yeah.
And so, again, we can bypass a lot of that and prevent a lot of that by just kind of doing some intentional work from the beginning. Yeah. Bridge that gap, get people back to those higher level activities.
So how are you currently finding clients? Like how are you in business growth mode? Because you said 2020 is when you guys opened, right? Or started this?
Yes. And then earlier this year is when we went like all in. I would say all of it is either word of mouth or social media. And so...
Can I make a recommendation?
Yes, please.
I feel like you guys could be partnering with the chiropractors.
Oh, we are.
Okay.
Yes.
I was going to say, because I would have loved this recommendation.
Yes.
You know, right from the, because my chiropractor was like, here, go see this massage therapist. Great. But it'd be also nice to have like you guys as part of the treatment plan.
Yes, exactly. So yeah, we've partnered with a lot of the local chiropractors in the area, a lot of doulas, midwives in the area, to really make sure everyone is aware of these services. And
with the online, you can like, doesn't have to just be this area, right?
It doesn't.
Sorry to cut you
No,
off
I
there.
know. Yeah, exactly. And so we do have referrals and people that we've connected with outside of that community as well. And so, yeah, it's very interesting.
With the virtual piece, it's like you can really expand. And I've been to maybe 4 or 5 chiropractors and none of them have ever recommended PT. Honestly, I think it's PT that I need. Like personally,
Yes.
like I think it's PT. I don't think it's
Well, I think
just adjustments.
Yes. Physical therapists talk about this a lot. We have a big identity crisis in the sense that like no one knows what we do. The public is
That's
not,
why I literally asked you. I was trying to make it like it seemed like it was for the audience, but really it was for me.
No, we are very aware. The public has no idea what physical therapists do and the benefits that we can have. And there's like there's so many different aspects and specialties of PT. Like across the age span, across different like conditions, like pelvic health is just one of them. But that is one most people, I would say, are not very familiar with. And they have no idea that we can kind of address these issues or like really we are the people, if you're dealing with pain, especially for an extended period of time, we are the people that you should be working with because we're the ones who are trained to deal with chronic pain, who are going to look at everything. And we're going to spend a good amount of time with you too.
Yeah.
I think that's the difference between like you go to your primary care or you see maybe a specialist, especially if you're using your insurance and maybe you get like 15 minutes with that doctor.
Yeah.
So it's like sometimes they don't have a lot of time to explain what's going on, or it's very much like, okay, here's what I think it is. Like, here's a prescription, or go do this, and like, I'll see you in 6 to 8 weeks.
Yeah.
But like, how much do they really get to know, again, what's going on in your day-to-day life? What if you're dealing with back pain? Again, you've got 2 kids at home and they're like, okay, great, you need to go do all of these things. And you're like, well, I don't have childcare. Like my husband is always working or traveling, so I'm gonna have to bring my kids with me, but my kids can't come to these appointments. Yeah. So like, what good is that recommendation if you can't actually go and follow through?
Yeah.
Right, and so it's like people will give recommendations or say things and they don't even know what they're actually...
Is it fitting with their lifestyle?
Yes, exactly. And so that's kind of the benefit too of physical therapists is, or working with someone who has the time, it's not just PTs, but someone who has the time to really get to know you and get to know your life, is we're going to be able to provide so many better recommendations as to what you can do and how you can really change things long term if we know what's going on.
Yeah.
So, and that's why, again, I love the virtual aspect to get into people's homes and see things, because like people have described to me or told me, they're like, okay, this is how I pick up my baby, or, you know, this is how I put them into the crib. And then I like remember a very specific incident with this where someone was telling me how she put her baby into the crib and she was experiencing a ton of back pain. And so she's describing it to me, and what I'm picturing in my mind is very different from what she shows me. So luckily I had asked her, I was like, okay, well, show me, like, we were on virtual, and I was like, go get your baby and put your baby in the crib.
Yeah.
And I was like, first of all, that is very different than what I was picturing in my head. And second of all, like, I can totally see why you have pain now. And the recommendation that I was able to give her was very different, again, than the recommendation I would have given her based off of what she was describing. So again, getting the time and the ability to see people in their day-to-day routine and getting to know like what is going on is how we make sure that people are not only getting better, but getting better and staying better.
That's great. I love that.
Yeah.
I love that. That's so exciting. As I'm sitting here in back pain.
I know. It's like 90% of people experience back pain.
Yeah.
At some point in their life.
I believe it. Yeah, for me, it was when I was pregnant with my first daughter, got in a rear-ended car accident. And there was like, a lawsuit. So I ended up getting paid like next to nothing after they did all the lawyer fees and all this stuff, right? But the pain never went away. Like it's always been in my neck, like down to my back. It's gotten worse and better like during different periods of time. 16 years ago to like help.
Yes, that's a long time.
So yeah, that's crazy.
And then it's like, we know too from the research, the longer that you're experiencing pain, the more that your brain actually starts to change. So we start to see changes around 3 months if you're experiencing pain, in the signals that are being sent, in the pathways they go through, and the way that the brain interprets that starts to change. And we get what's called smudging on the brain. I'm like, here's this whole like scientific background.
I love
Not that you
Give it
asked
to
for
me.
it.
No, I love it.
But we get what's called smudging on the brain.
Brain is smudged. Continue.
Yes. And so if you think about it, like think of a stain that you have and you're trying to wipe it, and all of a sudden it's spread everywhere, right? So that little pain that you had is now this widespread area that your brain has a really hard time understanding what's going on.
Yeah.
And so part of what we do, and this is kind of in the PT world, but part of what we do is we have to like clean the brain.
Unsmudge.
Yes, we have to unsmudge the brain, and we have to teach the brain basically how to rewire or how to understand better what signals are true and what signals are being sent, because the brain still thinks that the issue hasn't been resolved.
Yeah.
And so it's like, it's so fascinating when you go into the pain science of it. But yeah, we get what's called smudging on the brain. And so the longer you deal with pain, the more smudged it is. Yeah.
So it's been 16 years, so it's been really smudged.
Yes. So we can, but yeah, you just clean it up. And I always tell people, like, you've been dealing with it for 16 years or 6 years or however many years or months, whatever, like it's going to take us less time than that to fix it.
That's always a plus.
Yes, that's a benefit there. Definitely.
So looking into the future so it's called virtual physio.
Yes.
Did I say that correctly?
Yep.
Okay. How do you see your business looking in the next 5-10 years?
Oh, man. We have so many thoughts and goals and ideas. So obviously we want to just continue to expand. We want to help as many people as possible. And I think part of it is just making people aware of what we do and how we can help. And so things like this, where we get to talk about what we do and how we can help people, are just so beneficial for the general public to understand. So yeah, we want to expand, really hype up the virtual aspect and let people know that they can get these results regardless of where they are in the world. It doesn't have to be specific to your local community. Because I get people reaching out all the time and they're like, I wish I could work with you. Like, but
But you can.
I live here. And I'm like, you can totally still work with me. Like, absolutely. And so that's our goal for the next 5 to 10 years, is just continue to expand. How can we offer more in terms of the virtual aspect, and how can we increase access to PT and pelvic health services and education? Because so many people, like you said, they just don't even know about it. And so there's so much that we can still do. And so that is our goal, I would say, for the next 5 to 10 years, is just expand, help as many people, serve as many people. And
Education, I think, is huge.
Education, and then also just teach other PTs, like, how can you do this? Because really, like, if it's just me and my husband, or even if we have a couple people helping us, like, we can only
It's gonna be a
impact
franchise.
Yeah, but we
Right.
can only impact so many people then. So it's like you have to train other people on how they can offer these services, or how they can start to increase access, because it needs to be like a global effort. It needs to be a community effort in terms of increasing access. I don't think there is an abundance of pelvic PTs by any means.
I would agree
Like,
with
we
you.
need so many more. And we need so much more in terms of diversity too. And so just increasing that education, that awareness, and also training other individuals on what they can do.
Sorry, what I was asking is, so who are you outside of your passion for your business? And then it sounds like also you're a new mom.
Yes. Yeah. So that, I would say, is probably my newest identity, is new mom, and adjusting to having, I guess, almost an 8-month-old now, which is like crazy to think about how fast it all goes by. So that is definitely one of my passions, is being a mom, which I've always said I wanted to be a mom, but now that I am one, I think it's just a whole other level of passion and also understanding for the people that I work with, and the empathy I have towards individuals and the struggles of being a mom too. Like, the shit's hard.
Yes, it is.
Yes, even if people make it look easy, because I get that feedback a lot too. They're like, you make it look so easy. I'm like, whew, you have no idea.
Yeah.
You have no idea what's going on in my brain. But that, I would say, is probably my newest personality. Outside of that, like, I love to just be active. I love to lift weights. I love to do yoga. Love to hang out with our mom friends. And I'm a big advocate for just community involvement and kind of giving back to the community in whatever way that looks like. So I think I had mentioned to you earlier, one of the locations that we have is at what's called the Body, Birth, and Baby Center, which is just down the street from where we are now. And they do a ton of community events, and just looking to, again, engage different moms in the area or families in the area, just because I think COVID especially has made things very isolating. It's very hard to meet individuals. It's very hard to connect with people. And so what we're trying to do is kind of bring it back to the community and give people the opportunity to interact and engage with other individuals who are experiencing similar struggles or similar things. You know, you go to an event and you talk to someone and you're like, is anyone else's baby doing this? And like, everyone is like, oh yeah. And you're like, oh, thank goodness. I thought it was just me. And so it's like, it's a great opportunity, again, to be involved in the community and give back in a way where you just get to connect with other individuals. So that's what I love to do outside of running a business, but it all kind of blends together. I feel like it's hard to separate the things that I do. And I will say, being a pelvic PT, people ask me questions about their pelvic floor, like at all times. At all times.
And you're such an easy, approachable person too.
I try to be.
So that's like,
I try to be.
and the way that you talk about it, and the way that you're so open, it's like, oh, I can actually talk to her without feeling like weird.
Yes. And I think a lot of that comes too from just my own experience, and like growing up, I was very shy about these topics, and like would never, ever in a million years, like you would have never caught me talking about leakage or pooping or sex, like on a public forum, and now
Yeah.
that's like all I do.
Yeah.
So it's just really funny to kind of see me come full circle, but to also know that it took like a lot of work to get there, and a lot of what I call like graded exposure. I remember just trying to listen to podcasts about different things in terms of like pelvic health and women's menstrual health, just to get comfortable hearing the terms.
That way you could say them.
Yes,
and
exactly.
not,
So
like,
then you can say them, right? Right, exactly. And so it's like, let's normalize saying the word vagina as we normalize saying knee or shoulder. Like, we can normalize it.
Yeah.
But I think, again, so much of us grew up conditioned to not talk about those things, which what we've seen is if you don't talk about them, it doesn't lead to less issues. It just leads to less people getting help for these issues.
Yeah.
And so, yeah, it took a lot of work myself to kind of get
love
to
that
the point
you're
of
changing
like,
the narrative.
yeah, feeling comfortable, but definitely having a daughter myself now, I'm like, oh my gosh, we are going to teach her everything. And I bring her, because we run our own business, like I bring her to a lot of sessions, or you'll see her on calls with me if we're virtual.
Is she like chubby? I haven't seen pictures of her.
No, I mean, she's got some nice chubby cheeks and some chubby
8
legs.
months, that's a good age.
Yeah,
Like,
she's just super smiley and cute. But yeah, you'll see her at sessions, and we'll include her in sessions, and she's there here. I mean, obviously she's 8 months, so like she doesn't really understand what we're saying, but we talk about all the things, and I ask people, you know, about their bladder and their bowels and their sexual health in front of her, and we talk about things, and like there's no filtering or censoring, and I mean, there probably won't be.
yeah.
growing
up. It's going
up.
to be good for her to
Right, because it's
grow
just
up.
like, I want her to understand, that like, this is what pelvic floor issues look like. This is what's normal.
You realize she's going to be the 7-year-old kid.
She is
in,
going to
like,
tell all her friends
second
about all of
grade.
these things. I can't wait. I'm so excited. And the parents are going to come to me and be like, what is your daughter?
mean,
What is
like,
your child doing?
Well,
I can only
kind
imagine.
of my little
but
associate.
yes.
She's
exactly.
laying the groundwork.
Right. But at least, I mean, this is what I envision. At least she's giving her friends the accurate information.
Yes.
Like,
knowledge.
Right.
That's what I'm saying. This knowledge needs to happen actually at a
Yes.
younger age. That way we don't become 16, 20, 30 years old, like squealing at the word
Exactly.
vagina. Yeah.
So I had this conversation with someone yesterday, and we were talking about just growing up with good pelvic health, because she's got a 2.5-year-old who's dealing with constipation and has been for basically the last 2 years. And I was like, oh, I can actually help with that as a pelvic PT. And she was like, I had no idea. And so we started talking about all of these things, and she was like, wait, you're telling me there are like different habits or things that we could do like early on that could prevent our kids, or like that our parents could have done that prevented us from having all of these issues? I'm like,
You're like,
yes,
yes, ma'am.
Yes. And she was like, will you do a class on this? Will you
Yeah.
do a class for parents on like how to raise your kids with better pelvic health, or like optimal pelvic health? And here are like things you need to kind of take into consideration, like what's normal and what's not normal, and what are habits that we're instilling in our kids. Like, this is a really common one, and I'm sure maybe your mom did the same thing, but like every time we left the house as a kid, my mom would tell us to go to the bathroom. Even if you didn't have to go to the bathroom. Just try anyway.
Yeah.
And we know that that leads to bladder issues and pelvic floor dysfunction.
Didn't
And
know
so,
that.
yes, and most people don't.
I still tell my kids, go to the bathroom.
Exactly. And so
Sit on the
again, we're
toilet.
raising a whole generation, telling them to not trust when they have to go to the bathroom, and to always go. And that contributes to a lot of issues down the road. So anyway, I'm like, yes, there are lots of people who are now realizing, hearing about pelvic health, they're like, wait, we should be learning about this stuff like when we're younger.
Yeah.
I'm like,
I
yes.
agree.
Yes, this should just be like basic health education.
Yeah.
Just included in the curriculum. Everyone learns it.
For adults too.
Yes, absolutely.
Especially for the adults.
Yes,
Because we never
so-
got it. And
Exactly.
we never will if we never
Right.
go to school for that.
Exactly. So we're going to change the narrative. We're going to make people have healthy pelvic floors. Because you look at the statistics too. I had someone last week telling me about like prolapse and issues with having to get surgery. And I was like, okay, but that was a whole generation that didn't lift weights, that like didn't know anything about their pelvic floors, that didn't have access to therapy, and they went 50, 60 years with issues. Like, of course they're going to need surgery at this point.
Yeah.
Like, we are now intercepting 40 years earlier
Yeah.
in terms of when people are getting help. So I'm hoping we see this in terms of like surgeries
Shifting.
and
Yeah.
But like the goal is, if we again intercept right when people have babies, as opposed to waiting until they're 60, 70, 80 years old,
Yeah.
we don't need surgery. And you also have a great life. You save
Not
yourself.
suffering in the meantime.
Yes. You save yourself so much time and energy and issues.
In underwear.
And underwear and pads and all the things. Exactly.
Just to wrap it up, what's one piece of advice you would give the world?
Oh man, that is like so broad. I think if I had to say anything or like any piece of advice, it would just be to honestly to stay positive. Like, I know there's a lot of toxic positivity in the world. There's also a lot of toxic negativity. And I think...
Wait, what's toxic negativity? I've never heard I just heard negativity.
Yeah. I guess I'm just thinking people who are like chronically negative and
Yeah,
just
okay,
like,
okay.
you're like, oh my gosh, can you ever say anything positive?
Yeah.
But honestly, if we can look at things from a positive lens, or if we can spin things into a positive lens, even the worst situations that we are in, we can start to take accountability and actually make changes for the better. And so as hard as it is to do sometimes, if we can kind of look at things from the positive, I think we'll find ourselves in a much better place. And so I look back at 2023 especially, and that was kind of my mantra. And just like, come on, Lindsay, just stay positive. Like, things are going to work out.
2023, this past year?
Yes, this was like my big thing for 2023. I mean, I've always kind of been a more positive person, but 2023 especially, as
Did
we went
something
through...
happen specifically?
I think just going through this huge change of like...
Being a mom.
Becoming a mom and like knowing we were going to go all in our business and like we kind of had to make it work. My husband was very worried and I was like, I think if I just stay positive...
It'll catch.
And people feed off of that and they want that too. They see that and they see what you can do.
I'll have what she's having.
Exactly.
Yeah.
And so that I think is one of the biggest things that can help you be successful with your life, change your life. If you're a mom, dealing with leakage, like let's view this from a different lens. And now we're going to find ways to take action and actually fix this and think about how much better of a mom you're going to be and the way that you're going to be able to provide for your kids and your spouse and your job and do all the things that you want to do because of that. So that's my piece of advice is
My
find
last
the positivity.
question.
Yes.
Do you take anything for this level of energy? Okay. But really.
I had some coffee this morning, but I think this is just like you find your passion.
Yeah.
And like, this is just how I am talking about
Love
pelvic
it.
health all the time.
Absolutely love it.
Yes, I love what I do and I love the people that I can help. And I think just seeing the change, I've been in this world for 4 years now. And so I think just seeing how literally life-changing, if I had to describe pelvic health PT, life-changing it is for individuals, like you would have this passion too. So
I love your energy. Thank you so much for being on the show.
absolutely. Thank you for having me.